My name is Jeff Last, and I'm with Congressman Leonard Lance's office. He, along with Congressman Joe Crowley, are the co-chairs of the Rare Disease Caucus. And first off, we'd like to thank everyone for coming here today. And especially we'd like to thank everyone at NORD and RDLA for helping host and organize this event. They brought together a great group of speakers for everyone, and I think this will be very informative for anyone who has any interest in learning more about rare diseases and orphan products. As you know, or as you may not know, rare and orphan diseases affect 1 in 10 people in America. That's 30 million. And though the number seems staggering considering they're rare diseases, it's because there are well over 6,500, many of which that have no known treatments, no known cures, and in many cases, no discernible ways to get a clear diagnosis of them. Over half of them affect children, so this clearly is a big issue for parents, physicians, and it creates a lot of challenges, especially for folks on the regulatory side, on the research side, and even on the development of those cures that we so desperately search for. Today we'll be giving you a pretty good overview on some of the challenges that they face, as well as just a 101 on what are rare diseases and what are orphan products. Today we have folks from the administration, so I'd like to first thank Dr. Tim Cote, who is the Chief Medical Officer at the National Organization of Rare Diseases. I'd like to thank Dr. Ann Pariser, who is with the FDA, who is with the Office of New Drugs and Rare Disease Program at CDER, which for those of us who are in the health sphere know as the Drug Research and Evaluation Center at FDA. Dr. Stephen Groft, who is the Director of the Office of Rare Disease Research at the National Institutes of Health. And they'll give us a pretty clear idea of the challenges we face on the public policy side. We also have some great patient advocates here that will give us perspectives on the challenges they face every day, as well as folks from a lot of the different groups that are out there to help those folks who face rare diseases, to give us at least their perspectives on an outlook for treatments. So once again, I'd like to thank everyone for coming. I think you'll find this very informative. I'd like to thank all the speakers today because clearly this is something that they have a passion about, for them to be able to come up here and talk about it. And as always, the caucus is here to be a resource for members. Any questions you might have, any items that you might have an interest in, please don't hesitate to reach out to myself or Nicole with Mr. Crowley's office, because we're here to be that resource for you. So I guess without any further ado, I'd like to have Dr. Tim Cote come up.